Do you know the relationship between prostate treatment and gynecomastia? The most common situation a male will find himself with as you get older in his age of 50s and 60s is prostatic enlargement, BPH. And beyond that, it can also be prostatic cancer. And these diseases are actually treated, and they can be the treatment that you give to treat them can be linked to gynecomastia. One of the most common treatment for BPH, prostatic hypertrophy, is using blockers. For instance, finasteride. It actually block the conversion of DHT, which is responsible for enlargement of the prostate, and that's one of the byproducts of testosterone. And that can lead to, that can also lead to hair loss, can also lead to prostatic enlargement. And, finasteride actually is used. So what that does, it really upset, once you start, blocking that pathway, it can lead to imbalance between estrogen and progesterone, and also testosterone. The most important is really the estrogen and testosterone levels. And someone can end up with stimulating the gland in the chest and can end up with gynecomastia. And it's very common for males to be on these medications. As I mentioned, it could be for hair loss, it could be for enlargement of the prostate, but then they end up developing gynecomastia in these medicines. And these tend to be, males who are, could be as young as in their 20s and 30s or even 40s and 50s, for whatever reason why they're on. And then we have guys who have developed prostatic cancer that goes on androgen blockers that block the effect of testosterone, and therefore now you're blocking the effect of testosterone, so now you have estrogen predominance, and that's stimulating the gland. And if we look at this gentleman, this photo, you'll see that he, as a result of being on a androgenic blocker for just a year, and he developed gynecomastia, and it developed very fast. I was able to address this situation by actually doing gynecomastia surgery. And in his situation, we removed the fat, we also removed the gland. The gland, it was predominantly gland. So guys, we have to be aware that, these things may affect us as we get older, and treatment can actually induce other side effects. So it's something that we need to be aware of. Thanks, guys. Stay well. Are you interested in learning more about topics like these? Things that can affect our health in general? To learn more, and please share with family and friends. Sharing is caring. Appreciate it.